They said, "Hi, Shannon. This question is for the doctor. How can I naturally detox my son from lead and mercury? I still have not yet done the test to find out if he does have these toxins, but will soon. And I heard the metal detoxifier that doctors prescribed are really strong for the kid's body. My son is only 4 years old, so if the test comes back positive, I want to try to do natural detoxifier." And they said, "Thanks and God bless."
Oh, thank you. Yes, our body has its own natural detoxification system. And our environment, of course, is filled with a lot of toxins. Lead is a toxin in the environment we all get exposed to. It's not natural to have lead in our bodies, but most of us have a tiny amount of it. And hopefully our own detoxification system handles it. So I do recommend, it's good you're going to go and get the test done to see if there is a high lead level or a high mercury level in the blood. But even if the levels come back normal, you want to support your son's detoxification systems naturally. And you can do that through good nutrition. I recommend this book, Nourishing Hope for Autism, by the certified nutrition consultant, Julie Matthews. That may give you some ideas. Many children on the spectrum are believed to not handle gluten very well, and they may also, some children do or do not have trouble with dairy products. So you might want to talk with a nutritionist and look into that aspect. And then there's some supplementation that you can do. Make sure your child gets enough omega-3 fatty acids, which occur in fish oils, but you want to go with fish that aren't high in mercury, like salmon and so forth. And there's a lot of nutritional research going on how we can support our own natural detoxification systems and what's called our antioxidant systems. It turns out certain healthy vegetables like broccoli and broccoli sprouts are just rich in supporting our antioxidant systems. And broccoli also has something called betaine or trimethylglycine, which is important in that whole system for detoxifying. It's also important to make sure that your child gets a good source of sulfates in the diet, sulfur-rich foods, if they can tolerate those. So a little bit of garlic, leek, or onion as flavoring, if they'll tolerate it. We need sulfur as in the form of sulfate to help detoxify. So those would be natural ways to support the system.
Okay, wonderful. I'm going to move right on to the next question. Hi, Dr. Copeland. My son is 4.5 and struggles with constipation. I was wondering, my GI recommended Miralax. We've been using it for 6 months regularly. He still doesn't go to have a BM every day. Is it safe to use Miralax, and should he be going every day? Do you recommend a probiotic? If yes, what kind? Any other suggestions? He does complain at times when I give him Miralax of stomach pain.
Miralax is generally safe, and I do use it a lot, and it's used very commonly by GI doctors. But he may need more than Miralax to go a little bit more regularly. It really depends on the person's system. I definitely use probiotics. You want to have probiotics probably that have multiple friendly bacteria in it. So some of the various lactobacilli bacteria and the bifidobacteria. And there's a number of good labs that make these bacteria, like Kirkman Labs or Claire. And I might ask you, Shannon, do you have a favorite probiotic that you would recommend or that you tried with your son?
Absolutely. We in fact, the two companies that you mentioned, we cycle through different ones through each one of them. That we'll do Claire for a while, and then we'll kind of cycle off of that and do a one from Kirkman. Because I don't know, somebody a long time ago, and maybe you can tell me whether this is true, somebody had said that you shouldn't be on the same probiotic endlessly, that from time to time you should switch up which brand you use. I don't even know if that was good advice.
Well, that's a great question. There's some logic to think about it. I don't think it's been well studied, so I don't think we know the answer. But you're likely just like we like variety in our diet, a little bit of now and then variety in the probiotics. It doesn't sound like it would hurt.
Yeah, absolutely. And we've had really good results from both the Claire and the Kirkman. So I wouldn't be able to pick a favorite, but they're both really remarkable.
Yeah, I like the ProBio Gold. And to initially start the process, they may need a higher colony forming unit count. So the Super ProBio Gold you might do for the first week or so, and then you go down to a lower colony forming unit count for maintenance, because not all people will tolerate the really high colony forming unit count long term, especially if there's immune system problems. And not everyone has a bowel movement every day. I think if the combination of the Miralax plus using probiotics can give at least a half a cup of somewhat formed brown stool per day, you're pretty good. But there are some children, their systems are just, they tend to go once every 2 to 3 days. And as long as they're not getting bloating and distension, gas, and a lot of discomfort, that might be an okay pattern for them too. I've used Miralax long-term over several years for children with cerebral palsy who, due to their motor conditions, they are prone towards chronic constipation. So it can be used safely long-term. But if you can optimize the diet with good, healthy sources of fiber and fresh vegetables and healthy fruits with the probiotic, you might be able to ease off on the Miralax.
Okay, great advice. Moving on, next question. Hi, my son is 4.5 and been getting sick a lot since he started a new school. I'm giving him a multivitamin, Rainbow Light Kids, 1 multivitamin, and probiotics, Primodophilus. But he has been sick for over 2 months. I'm very concerned because he needs to catch up, but can't if he's sick during ABA and school. We went to the allergist, asthma and sinus center. The doctor prescribed 5 meds and found he has asthma and a sinus infection. I don't like that I have to give him all these meds, including prednisone, but it's only for a week, and I just want to get him better. We will have a nebulizer at home as well. My question is, what multivitamin probiotic do you recommend that has worked for my son? And any suggestions, that would be great. He's a thin kid and looks frail, even though he does eat different foods. And thank you for the show. And thank you. So what do you think, Dr. Copeland? It's that time of year, and I can appreciate what this parent is saying, because you get behind. I got a kid who's sick at home today.
Right. Well, I think she did something very good. I'm what's called an integrative pediatrician. I don't just practice mainstream medicine, nor am I solely biomedical or complementary alternative. I integrate the fields together. And that's what this mom did. She appropriately went to the allergist. And I take asthma very seriously. So the chances are the child needs those 5 medications for now. And I don't think she should feel bad about going on them or putting them on prednisone. I give short courses of prednisone. As the mom said, it's only for a week. And that's been shown in long-term studies to be safe. And then what he might need is an inhaled anti-inflammatory, an inhaled steroid that doesn't get absorbed into our bodies fully, but really helps the lungs heal. So it's kind of a preventative. So she should really understand the purpose of those 5 medications, which ones are temporary short-term, like the oral prednisone, but which ones are daily and really needed. And then in addition to working with her allergist and using these medications when needed, because if you get the wheezing with asthma and you need that rescue inhaler, that's life-saving. You don't want to be afraid to use it. Those are evidence-based medicines. But she might want to have a discussion, okay, what could be the trigger factors? And some of it, like you said, Shannon, it's the season. We do have more colds and flu as the weather changes and it gets colder, the winter season. And children, as they get around other children, they're exposed to a whole wide range of viruses. So an otherwise healthy child can get at least 12 virus infections a year. And each virus infection can last up to 2 weeks.
Wow.
So you're talking about 2 weeks out of every month, they may have some symptoms while they're building up their immunities. So not to feel bad about that, but once they have a discussion about what might be their child's triggers for the asthma and allergies, so, you want to try to avoid triggers. It's rare to have food triggers be a trigger for asthma, but sometimes they are. Foods that have sulfites in them, and including preservatives. You want to stay away from any kind of food dyes and food additives and preservatives, because the sulfites in those preservatives in some sensitive individuals will trigger asthma. Same with foods that are high in salicylates. About 10% of asthmatics may be triggered by food, so it's not the majority of them. And then you look at other things, try to decrease exposure to cigarette smoke, see if they're sensitive to dust or molds or pollen. We can get a HEPA air filter for the home. So all these things. And then back to strengthening their own detoxification and immune system. In France, interestingly, they use Epsom salts baths. Epsom salts is magnesium sulfate. And we know that a little bit of the magnesium and sulfate are actually absorbed through the skin. So that's one good way to get sulfates for your detoxifying system to strengthen the immune system. It's just important that you have a child. You don't want them playing and trying to drink the bath water, because they could get too much of the magnesium sulfate and give themselves diarrhea. But I would say just those general good health principles, plus teach good hand washing and not eating after each other, because that's an exposure to viruses, and viruses can often trigger asthma. So hopefully that gives her some ideas that she can work on.
Wonderful, wonderful. I'm going to move on to the next question. Hi, Shannon. This is for Dr. Copeland. Recently heard that vitamin C and magnesium/calcium cannot be dosed together. Is that true? I thought vitamins could be dosed together, but these nutrients are because these nutrients are found in food. And thank you for being available for Autism-Live. And we appreciate you being available for Autism-Live too. I'm interested in this too, because we've been giving vitamin C and calcium and magnesium at the same time. Is this not the thing to do?
Okay, I'm not a nutritionist or a pharmacist, so I may have to do more research on it myself. But my understanding of the issue is that if you give calcium and magnesium together, that's really the issue. It's not the vitamin C. It's more if you give calcium and magnesium, they're transported from our intestines into the body with the same transporter mechanism. So they compete with each other. So if you feel you need to supplement with both calcium and magnesium, it would be best they can have it the same day, but they just should not have it at the exact same time. I don't think vitamin C interferes with either the absorption of calcium or magnesium. And in fact, vitamin C helps the absorption of iron, a different mineral. So I think it's more the competing between calcium and magnesium.
Okay, great. Another person writes in, and I'm interested for your point of view on this. Hi, I have a little 4-year-old brother who, when given the opportunity, will stare at the sun and blink. You can distract him out of it, but he will still do it. Could this be a stimming behavior? What can we do to stop him from doing this? He has language, and thank you so much for help. And originally I was going to ask Dr. Granpeche this question, but I wanted to hear your take on it, Dr. Copeland, because I'm concerned about the well-being of this little boy's eyes, in addition to this stimming behavior. So there is a medical component to this.
Well, if he's doing it really frequently, then I would be concerned. But I'd also be interested in Dr. Granpeche's take on it, because my take was mainly from a behavioral point of view. It sounds quite likely that this is stimming behavior, or what we refer to as self-stimulatory behavior. If he's doing it excessively frequently over his lifetime, if he doesn't outgrow that habit, it's going to increase his risk of developing cataracts later in life. So like for my glasses, I have these transitional lenses that immediately darken to decrease the amount of sunlight exposure that I get, as cataracts tend to run in my family. But a funny thing is, I remember as a child, I was fascinated by looking at the sun, and I would do that periodically. But I didn't do it a lot. I didn't do it every day. So I think a little bit of it is not likely to cause immediate problems. I would think if the child has an ABA program and a behavioral program, they could do a functional assessment and see what the payoff is for the behavior. If he would do it even when he's by himself in a room through a sunny window, say, then that's, if you do it in the alone condition, then it's likely self-stimulatory. It's what we call automatic reinforcement, that just the sensation of it, something about it is interesting for him. So it's a sensory seeking function. If they do the functional assessment, sometimes he might like the reaction he gets, like suddenly he gets a lot of attention from his parents or his therapist because they're worried about it. It could be an attention-seeking function. So it's important to do that, a functional assessment. But at any rate, if it is mainly for self-stimulation and automatic reinforcement, they could come up with a behavioral program to address it. Like teaching an incompatible behavior, like playing appropriately with maybe a toy that lights up. So there'd be some of that same sensory stimulus, but more appropriate and one that's not going to hurt his eyes. And they would just differentially reinforce him for playing with the appropriate toys. So I think that could be addressed in their behavioral program.
Okay. Moving on to a question that's interesting, because I have a question based on what they wrote. They said, hi, this question is for Dr. Copeland. My 4.5-year-old son is always on the go. He has a lot of energy always, and he's on a GF-CF diet, so I know his yeast is under control, and that's what I have a question about. They go on to say, I was giving him GABA for a few months with a little improvement. Now I ordered GABA again, but it also has something called niacinamide and inositol. Have you ever heard of this? If not, do you recommend something that would calm him down some, but something that does not need prescription? I want his body to be calm, but not for him to be like a zombie. He's about 32 pounds, and thank you so much. And my question is, as we start into this, is that my son has been on a GF-CF diet for a long time, but when we had to battle yeast, we had to do things beyond the GF-CF diet, because to my knowledge, the GF-CF diet doesn't help with yeast. Am I in the wrong neighborhood?
Well, certainly the gluten foods may aggravate yeast. So the GF-CF diet is helpful, but it may not be enough. Some kids, if they're particularly sensitive, may need a specific carbohydrate diet where there's a little bit more restriction. What did you do, Shannon, when
we did a modified specific, we did the specific carbohydrate for a little while, and then we had to quickly modify it. But
right, because it can be too restrictive, and you don't want any diet to be too restrictive in the long run.
Yeah, and we did, we went through a biomed cycle with some meds that we did. We did that twice, and we took all sugar out of his diet, which I think was as helpful as the biomedical intervention that we did.
Yeah, I'm actually concerned about the biomedical interventions. I think you have to be very, very careful with them, because I think it's sometimes underplayed that the antifungal agents can be damaging to the liver. And prior to the use of antifungal agents in autism, there was no data on long-term use of antifungal agents in children. So we have very limited data. But interestingly, coconut oil, which is a healthy oil that we could use more of in our diet, is a natural antifungal. So that may be an option right there, is they can add a little coconut oil.
I love that.
From coconut oil?
I love that. I love the idea of putting that in. That's a wonderful thing.
Great. And then there's other things that can be done nutritionally to support. So it's natural to think about GABA, and GABA combined with niacinamide, which is vitamin B3, and inositol, we would hope and think it might work on hyperactivity, but there's actually not good evidence that it does. The reasons why you might think it might is because GABA is the main inhibitory neurotransmitter in our nervous system. But there's just not been good scientific evidence that it's really specific for ADHD type symptoms or the hyperactivity. But it can be well tolerated. Similarly, niacinamide can be well tolerated. There's vitamin B3, and niacinamide has kind of some mild calming anti-anxiety properties. Now, inositol, there's different types of inositol. It can be in animal products, it can be in plant products, but we're usually thinking of what's called myo-inositol, which is from animal products, and our own body makes it. And it also has anti-anxiety properties specific for obsessive compulsive disorder. And it helps with insulin resistance in kids who are overweight and might be at risk for type 2 diabetes. But there's been no specific studies of niacinamide and inositol for hyperactivity symptoms, or even combined with GABA. On the other hand, nutritionally, there have been specific studies on using omega-3 fatty acids for attention deficit hyperactive type symptoms, as well as for autism spectrum disorder. Mm-hmm. And there's now several studies showing some modest benefits. So I think supplementing the diet with omega-3 fatty acids from fish oil, which could be, from your health food store. They could either be in an oil form or a capsule if your child knows how to swallow a capsule. And then the University of Maryland Medical Center has done some studies combining the omega-3 oils with some natural and more healthy omega-6 fatty acids. So we need a balance of omega-3s and omega-6s in our body, in our metabolism, and also in our diet. And American diets tend to get too much omega-6s and not enough omega-3s, but we also might be not getting the healthiest type of omega-6s. What the University of Maryland studied was combining omega-3 fatty acids from fish oils with what's called evening primrose oil from a plant that has the most healthy combination of omega-6s. And using those two together, they did show some definite benefit for hyperactivity symptoms. Wonderful. So that's something that nutritionally could be done.
I hate to interrupt you, but we're almost out of time. We got about 20 more seconds. But one of the things that I recently have been seeing in the studies, that when people talk to me about hyperactivity and focus, is recommending that people look at the Dirty Dozen and the Clean 15 and try to be as organic as their budget can do. And so you agree?
Yes, you want to eliminate known trigger factors again, and red food dyes, preservatives, a lot of sugar, things that are not healthy. You want to get rid of those from the diet, and foods that are high in phenols, which would include a lot of additives, MSG, any free glutamate. So are those the kind of things that you were thinking of?
Well,
get the lights back on.
Oh, sorry. I was thinking of pesticides, organophosphates, that if we have the Clean 15 and the Dirty Dozen in terms of being organic, what things have more pesticides?
Also important. I mean, there's so many aspects to think of. So yes, go organic, try to avoid pesticides in the food. They are a risk factor for causing autism and for aggravating ADHD, yes.
Wonderful.